Hello, I'm here with Lynn, one of our surgical patients, and Lynn went through having a lower face and neck lift with us about
October 7th.
3 months ago. So she's 3 months out, but I wanted her to tell us about her journey. Her journey was a little bit complicated, and the reason is that's why I want her to talk to you guys, and that's the reason we have her here today, because we wanted to tell you that even if you have a little complication, as long as your surgeon is capable of handling the complications and deal with it in an appropriate way, you still can look as gorgeous as she can. So that is how I thought about doing this video. It's more educational for all of you guys out there that you're thinking to consider surgery. Surgery should not be scary, should be in the right hand with the right person, and I think that's the key. Yeah, Lynn, tell us about you.
Right, so I was not hesitant at all with surgery. I've had multiple surgeries before, never had any scarring issues, nausea, bleeding, nothing. And this is the first time ever at the age of 55. So when I woke up, I was having a hard time breathing, and I was told that I had a bleed behind my ear, and after the packing, it was, my blood pressure kept going up. So I had two issues going on. And I woke up listening to my husband and the doctors speaking, and the decision was to call an ambulance, and everything was fine by me. I trusted everything, trusted everyone. So went to the hospital, and Dr. Rostami was calling and texting and with my husband and with my doctors, and I had a real isolated incident where I had just a blood pressure go up, but I think it was because they were packing the bleed, and it went around my carotid, which when I woke up from anesthesia, I had a bit of a panic. I was in the hospital for 2 days, and I've been here ever since for anywhere from every week to now it's once a month to just do a checkup and to do some laser of my bleeding areas, or where the blood settled. But I can't be more pleased. I am about almost 4 months out. I can't be more pleased with the results. Friends of mine have said, I didn't know you in your 30s, but I feel like we're meeting you in your 30s. And I had jowls and, you know, a neck, and people are like, why'd you even do this? Because they're looking at me in reverse. And I would not hesitate to do it again, even with the slight complications.
Yeah,
I had a great time.
So during the procedure, her blood pressure went up. So the blood pressure was morbidly high. So it was very consistently elevated. And the reason we had to put the packing was because of the possibility of bleeding, and which she did have serious bleeding, and it was because of the blood pressure. And we tried to control the blood pressure, and it was very uncontrollable. So we decided it would be better for her to be in the hospital under supervision of physicians during the night and nurses to take care of her. It would have been too much for her husband to be able to take care of her. So that was the decision we made, and I really think that that was the important decision we made.
Yeah, there was no hesitation.
Yeah, I think that was the reason she did very well afterward, because they were able to control the blood pressure. Then we brought her back. We took care of the hematoma, which is very important for facelift. You can have skin necrosis, because if you leave the hematoma, and we had to evacuate the hematoma.
Add a drain.
Yes, and we placed the drain for her, and the drain actually was draining for 3 days. So that was important to have all of that done. So it's important for the surgeon to be capable of handling the complications. Not everything goes perfect. Not everything is going to work out exactly as we predict. We are human. So all of us, we will have things that can be causing issues during the surgery or after surgery, but it's all important that the person is experienced to deal with them.
And there was no hesitation either.
Yes,
It
exactly.
was, yeah.
I really wanted to say that the doctors usually care for the safety of their patient, not so much for their own whatever. So number one is safety, and that's what we try to do. We wanted you to be safe, we wanted you to be taken care of. and I think the best place was for you to be in the hospital.
Yeah. No
So
one-
that's it. This is all I wanted to tell
Yeah.
you. We're gonna put some of her before and after, so
Yes.
for all of you to see how gorgeous she looks.
Yes, people are like, why'd you do this? And I show them the day of photo, and and they say, oh, I didn't realize you looked like that, even though I knew you.
Yeah.
So pleased.
Yeah.
So pleased.
Thank you.
Thank you.
Thank you for doing this. I appreciate it. It helps others.
Oh,
Thank you.
absolutely.